Hey everybody, Bob Lazaro from All Things Leland. Thanks for joining us. Certainly, there's been a lot of news about healthcare and healthcare access in Leland and the region, and I'm happy to have as our guest Kevin Briggs, who serves as the president of the Novant Health Brunswick Medical Center property, who is going to talk to us about the system's investment in Leland and in the region in general. So, Mr. Briggs, thanks for joining us. Appreciate it.
Yeah, thank you for having me. Yeah,
You're welcome.
absolutely.
You're welcome. Let's talk about Leland first because that's foremost on most people's mind. And I did drive through the Terrapin property, so I saw exactly where your facilities are going to be. But let's talk about that, what that means in terms of service and access in the future. Plus, we could talk a little bit about your new facility on 17 here in Leland as well.
Yeah, well, thank you for that. Yeah, we're really excited. We did get our approval for the run our hospital there in Leland, which will be Novant Health Leland Medical Center. It's going to be there, as you mentioned, right there on the western side of the county, northwestern side of the county there. So what that really means is, for our residents in Brunswick County there on the north side and the northwestern corridor, and even into the adjacent counties, we'll have closer options for
Mhm.
healthcare. And we're really looking forward to being able to do that. Not only will it take care of those individuals, but just organically because they wouldn't be traveling to one of the other facilities,
Sure.
it's going to have a regional impact. So that access point will certainly be a player as far as improving the capacity across the region.
Sure. How many beds is this going to be, and what kind of services will be provided?
Yeah. So it's a 20-bed facility.
Okay.
And we'll be able to obviously have 24/7 emergency support
Okay.
there. So we'll have an emergency room. We'll have wraparound services to include pharmacy,
Okay.
laboratory medicine, imaging, all the
Okay.
modalities of imaging there as well. So really, and a person there can go there and actually be an inpatient, and
Okay.
be able to be taken care of. So it's gonna, from a community hospital standpoint, it's gonna give those acute level of care that people
Hmm.
need, and then we'll also be able to leverage like our tertiary care center, for anything that couldn't necessarily be
Okay.
taken care of. So still using that regional approach.
Okay. And I think I read somewhere there'll be some observation beds as well, so you could be able to be there or and maybe be able to leave the same day, et cetera.
Absolutely, yeah, that'll be part of the model
Okay.
that we'll go in with. Mhm.
It's interesting. These things take a long time, and it's a big investment. And a lot of folks think of Brunswick County as well. We have a lot of tourism, but healthcare is the second largest employer in Brunswick County, and it's fast growing in the region as well. So, in terms of people, I mean, how many folks do you see? I realize it's not all at one time, but what do you think your hiring is going to be in terms of the number of people?
But the good thing is, working as part of a larger system. This is one of the benefits of being Novant Health, is that we actually have tools to help guide
Mhm.
us, and help
Okay.
us ramp up to the staffing. We also have intel on knowing which positions are actually harder to fill, so we
Sure.
might need a little longer runway to get those.
Hmm.
But it also gives opportunity for people who are already working inside of our system who may want a different site of care to partner with.
Sure.
So we'll have a certain percentage of our team members that'll come from different places. That way we can continue to carry the culture of Novant
Okay.
Health into our new facilities as well. So we're looking at the hospital beginning operations around 2030.
Okay.
So that gives us the time. We're already, starting to discuss what our needs are, and we'll
Okay.
be able to have a strong plan around staffing there. So not really a primary concern for
Okay.
us, but workforce development is something that we already work diligently in each day at our existing facilities.
So I had read when the announcement came that you were moving, there would be medical offices that adjacent as well. Is that going to be Novant or that'll be a private party developing that?
Still, it'll, I would say probably early to tell.
Okay,
Obviously, it's a continuum of looking at, what
sure.
access we need. So
Okay.
it may indeed be a mix of those.
Okay, okay, and as most folks know, the outside of the building is always done a lot quicker than the inside with the specialized equipment, et cetera, and the lead time to be able to do that. I mean, there's one new building that's happening right here now in Leland on Route 17 is your new day op facilities, and perhaps you could share a little bit about the types of services that you anticipate and when that ribbon cutting is going to be understanding that not all things are under your control.
No, that's fine. We're really excited about our new Leland Outpatient Surgery Center.
Mhm.
That again is right there on 17.
Mhm.
Things are certainly being polished at this point.
Okay.
We would begin seeing patients in August,
Okay.
with still having a few pending approvals during that time, but
Sure.
it's just a process that you normally go through
Okay.
to get up and running. So we're really excited about that, and we'll be having our ribbon cutting for that not long from now. So
Okay, that's
really excited.
great. That's super news.
Yeah.
Anytime you don't have to go over the river to get a service, even better. I mean, that's really super. The company's investment in the region. I mean, the big announcement was for in New Hanover County, $1 billion plus investment, heart and vascular. Previous life, I worked for Novant Health system, and they had a heart and vascular progress. So that goes through a certificate of public need process. So is that where we're at right now with that?
Yeah, the yes, absolutely,
Okay,
and we are really excited because it's not one of those things where you would have every 20 miles or so. So
sure.
just yeah, and there are lots of communities that won't have something as nice as that Heart and Vascular Institute. So we're super excited about having that here to take care of patients across the Southeast.
And
Um,
that'll be an employment drawer as well, obviously.
Absolutely, absolutely. Might need a little more runway for that one. That's a big one. So
Yeah, no, that is a big one, and attracting the folks, the staff, having worked for Innova and have interface with the docs and the nurses and the techs, et cetera. It's not a small undertaking to take something up and off the ground. So that COPN process, I am assuming has not started yet. I mean, do you all have a some sort of timeline when you think that will be?
Yeah, I'm not exactly
Okay,
sure
okay,
what that timeline is for the
okay,
HVI there,
okay.
but we're again, we know that the need exists
Okay.
in the area, and just happy to be a player for that.
Super. Well, listen, thank you for your time. I know you're really, really busy with things going on, trying to open a facility, working on planning a new facility, plus all the different parts and pieces that match up with it. Perhaps as we get along and we can match up schedules again and you have a little bit more about the heart and vascular, we'd love to talk to you again.
Yeah, absolutely. Looking forward to it. Thanks for having me
Super.
as well.
Well, thank you.
Okay, take care.